Welcome to our channel. This is Dr. Kende Elisha. I just want to give you a little bit of a taste, I can say, of our bridge or mentorship program. And of course, if you pass your boards already, and then what next? We want to put our degree to work. We want to be able to achieve something with it. Of course, that's going to be everybody's goal anyway. So the bridge program is a place where you can either connect with a new job with ease, or if you want to build your own practice, we guide you on how to do that. And it's also loaded with a bunch of content when it comes to how to diagnose, how to assess, what to look for, and so on. So our key content, what does it really focus on? We usually talk about types of assessment, interview and interaction, clinical vignette, documentation. So when we talk about types of assessment, what are we looking at? So when we conduct clinical interview, how do we conduct it? Do we know how to do MSE? Do we know how to do risk assessment, psychological testing, cognitive assessment, functional, forensic, or legal issues that we may run into? Do we know how to handle all of that? We have a patient with comorbid condition, even with substance use. How do we assess them? Cultural or psychosocial must also be put in play whenever we're assessing our patient. Do we know that? So interview and interaction, how are we supposed to interact with our patient? What questions are we supposed to ask and what questions are we not supposed to ask? Now, the initial visit questions, do we have it down? Therapeutic alliance, are we able to maintain it? Then we're going to be talking about case scenario. We're going to have a simulation, something to help us connect the dots with, okay, how do we interact with our patient? When the patient says this, how do we respond? So we're going to come up with some complex cases, very, very interactive Q&A, covering differential diagnosis, covering assessment, risks, MSE, functional impairment, any kind of treatment planning that may be related to the case. And documentation is always somebody's issue anywhere you go. Okay, so documentation is also something we're going to try to make life easier for you, how to get through that hump without sweating. Now, common inpatient or outpatient forms like intake, MSC, progress note. Do we know how to, get things done quickly and still be efficient? Listen, if you struggle with documentation, your provider will not be happy with you. Even if you own your clinic, if you struggle with documentation, you will not be happy with yourself. Because without complete documentation, how do you get reimbursed? So documentation equal to money. That's the way we see it. So things have to be well done when you are working for somebody or when you're working for yourself. So risk assessment, medication tracking, consent, discharge, behavioral observations, cultural and psychosocial forms. These are all forms of documentation we're going to be looking at. Then psychopharmacology-wise, we're going to be talking about guidelines. What guidelines do we need for assessment, for monitoring, for patient education? What guidelines do we go by? Listen, we have all kinds of guidelines. We have APA guideline, the CANMAT guideline, the NICE guidelines, and so on. And then drugs, which drugs can induce mania and depression? We must pay attention to that so that when we get this symptom being reported by a patient, we know exactly what led to it or what caused it. So we have to pay attention in reconciling meds, whether it's our patient, whether we prescribe that drug or not. Now, what about safety and crisis management? You can also teach the patient when are they supposed to call 911 or police, or when are you supposed to call 911 police or even CPS? How do we manage suicidal, homicidal, or any kind of violent or abuse patients? What are we supposed to be doing when we have telehealth safety considerations? You are interviewing somebody on tele and something is about to happen. How do we handle that? And a lot more. So to join our community, it's very easy. Visit www.confidentprescriber.com or go to npcertificationacademy.com to connect with that website, or you can email nurse-to-nurse-coach@gmail.com. I'll be guiding you through the website now on how to join our bridge program, and we'll look forward to having you in class. So this is our Confident Prescriber website. You're going to see home and about us, courses for post-certification. That means if you have not taken your board exam, this is not where to be. For certification courses, like to pass your board exam, you need to go to npcertificationacademy.com. This is post-certification. You can come attend our PMHNP mentorship and bridge program, FMP, AGMP bridge program, AGACMP psychotherapy masterclass, psychopharmacology masterclass, psychiatric assessment, depending on what you want. Now, let's take the PMHNP bridge program as an example. So what do we have loaded here? So this is going to be us mentoring you, taking you through the content that you actually need to survive life, assessment, concepts, diagnosis, planning, implementation, and evaluation. And once we're done with that, the very last 2 weeks, which is we're gonna change this to 8 weeks soon, okay? The last 2 weeks is gonna be about business. That's our freedom class. We've added that, we've merged that together. The freedom class is where we're supposed to do what? Support you and get you through the hump on how to set up your clinic, the little tools that you need to master yourself to kind of cut on costs. We're going to show you all those apps, where to go so that you don't stumble. And if you want to work for somebody, how to get through the first few weeks of the job and how to avoid getting into legal issues, we're going to show you all of that the very last 2 weeks. But the very first 6 weeks is going to be simulation, case studies, and content that will help you build your career. Don't forget, pharmacology is where we're going to spend a lot of time. Pharmacology and therapy will also be integrated here. And then pharmacology is going to be, okay, how do we prescribe, for example, SSRI? What are they? How do I make a selection of SSRI? How do I assess if a patient really should take a certain SSRI? Do they meet the criteria for the side effect profile? Do they, after taking it before and they were resistant, what, should we switch to something else? What is the age of the patient? Do they have any comorbid condition that will prevent them from taking the particular SSRI? So those are the things that we also teach you how to also assess the meds before you give it. Then those meds, we're going to show you how to reconcile for, drug interaction, food-drug interactions, and are they taking any kind of drugs outside of psychotropics, and how to, look up those drug interactions and prevent any kind of, danger in future. And of course, we have to also prescribe in a way that patients will comply with their meds. Are they taking too many drugs in a day that they won't even remember? It's going to become a burden. If they're taking a medication 4 or 5 times in a day, or can we cut it down to just once or twice in a day? We're going to be teaching how to do all of that. Now, that is the Bridge program plus the Freedom class, as well as mentorship program. We also have something called the real-time collaboration. That means you have a real case that you want to discuss and you need some guidance. Dr. Kehinde Elisha will guide you through how to actually resolve that case. We also have the 2 different groups. We have the expert group and we have the Bridge program group. Now, the Bridge program group, if you publish your case in real time, we're going to be able to collaborate. We're also going to set up a Zoom time that we can meet and talk about cases. Remember, you have to review your case days in advance before you resume work, and then you can bring your case to us. We're going to help you. That is also within this program. All right, so there's a lot more value to this, and at the end of the day, you're going to get 25 CEUs just by going to this program, okay? Now, we have 2 separate times, a Tuesday class at 6:30 p.m. Eastern Time, or a Saturday class at 4:30 p.m. Eastern Time. Yes, these times will change, okay? Now, what about Clinician Growth Package? That one is just pretty much a year-long course. We also bring students in here whether you pay or not. We bring you in here to check it out, okay? For 3 months, and if you like it, you stick around with us. If you don't, then we keep it moving. Now, our Bridge program is content dense. Our Clinician program is just a very tiny content, but it's more interactive. So we talk about general things, we network, we sign things, we do things in there. So we do so many things. I teach for 30 minutes only, and then the rest is interaction, like the NP rounds. We do it there. We do some networking. People connect, exchange numbers. People from different states, they try to connect and collaborate that way. Mostly is about growth. This group is all about growth. Listen, the group that you join, ask yourself, how is this group going to help me grow? If it's not going to help you grow, it is time for you to check out, okay? We also have an association formed within our group. It's called International Association for Clinician Advancement. That is to tell you that we are truly committed to your growth. We are what? Truly committed to your growth. This is not a selfish group. We are truly committed to your growth. Any group that you're going to belong to, if you go to a review group, after 3 or 4 days, they tell you bye-bye, you are not in the right group. Listen, you want a group that will assure your growth continuously. So we add it to our expert group after you pass your board exam. And these courses are not mandatory. Our expert group is very free. Your clinician's growth package, you can join for the first 3 months, and then the rest you can choose to pay for it for $199, or you can choose to keep attending to get your feet wet and see if you really like it. That is on every Tuesday at 8 p.m. Bridge program is twice a week, Tuesday and Saturday. Clinician growth is only 1 day a week, Tuesday. Automatically, if you sign up for the Bridge program, you are automatically qualified to be in the growth package. Listen, it is not really gentle out there. A lot of people are struggling to find jobs. You want to maintain your skills, you want to maintain your content, and continue to learn with us. Dr. Kehinde Elisha speaking here, CEO and founder of MP Certification Academy. I'm founder of Satisfair Center for Behavioral and Integrative Health. And we also have International Association for Clinician Advancement. We're setting it up right now. It's going to be membership-based, very, very low cost, reasonable membership, which you're going to learn a lot from and you're going to grow within the group. Thank you so much for taking time to listen to my video, and have a wonderful day. Bye-bye.